Good morning. This is Bernard Crespi from DataTel, and today I have Jonathan Reek, Healthcare Solutions Consultant of Major Accounts at Global Payments. Welcome, Jonathan.
Thank you so much for having me. I'm excited to have our conversation here today.
So, healthcare providers have invested heavily in digital systems, but when it comes to payments, things still feel a little bit fragmented. Patients expect simple consumer-like experiences. Providers are dealing with rising costs, staffing, pressure, and compliance, and payments sit right in the middle of that tension. So today we are going to unpack the real challenges behind healthcare payments based on what we are seeing across the market. So, Jonathan, when you look at healthcare payments today, what stands out to you as some of the biggest disconnects?
Absolutely. So what we often see is payments are an afterthought. It's not the primary focus. In fact, it's often piecemeal together, right? There's not a core strategy with it where it's just reactive, right? Oh, we need online payments. Let's get some online payments. Oh, someone's calling on the phone for payments. Let's find a solution to make that work. It's often fragmented pieces that are not working as a cohesive whole. Sometimes and oftentimes staff don't have time to just sit down and reevaluate the whole process. That's where partnering with like a good vendor or vendors to help walk you through that process and try ameliorating that might be a good idea. So the biggest
So,
thing,
so what you're saying
yeah,
is that it's been the pieces, the modules have been pieced together over time. No one person perhaps really knows how all of this actually works,
yeah.
and they've done over a long period of time as in a reactive mode. So let's start with a little bit about the patient experience. We can order food, we can book travel, we can pay bills in seconds, but healthcare payments still feel a little bit different. Why do you think that healthcare is still behind in terms of the payment experience?
That's so true. I mean, look at Amazon. You can press buy now by accident so easily, and you do everything. It just pays automatically. It ships to your house the next day. So for those type of systems, they figured it out, right? In healthcare, payments are an afterthought, right? In Canada, especially, we are patient focused, right? We're care focused. US, it might be a little bit different, right? They might be focused more on the financial aspects. In Canada, it's really patient focused. So payments are a small part, if any, like it's just a tiny, tiny, insignificant part for most organizations, where it's often a very far afterthought. Putting a little bit more time and effort into it can really help that patient experience, right? Paying is the part that patients hate the most. Sometimes it's even unexpected, right? So making that as a smooth as possible process for everybody involved, from your staff, from an organizational staff to the patient, the better, right?
So it sounds it's not really a technology problem. It sounds more it's a design problem,
That's a
in
great
how
point.
payments are actually structured in healthcare today.
That's a great point. Yes, that is absolutely true. I mean, it's not a technological limit, right? It's like you said, it's a workflow issue, where for like freedom of information, right? They might have a complete separate process of how they get payments for the release of information, right? If it's a $5 fee or whatnot, they have a complete process for that. If it's for the gift shop, they have a completely different process for that. If they have online payments for a specific item, or renting a gown, for instance, for some of their staff, completely different item than the patient actually visiting the site. So they might have 30 different workflows for 30 different payment types, rather than just trying to simplify that in a little way by going through
Well,
everything.
and it's interesting like that. So, and I'm going to sort of move on to a thought that's connected to that. What patients see it as friction. But behind the scenes, the interesting thing is, from our experiences, that is even more complex. There's multiple systems involved. You have EHRs, you have billing systems, you have billing team, you have portals.
Ledgers, yeah, yeah.
Where do you think that, are you seeing most of the fragmentation showing up?
Yeah, most of it is happening not on the patient billing side, per se, like whatever is happening in the hospital information system. It's happening with all of these add-on processes. Sometimes you're trying to leverage, or we're seeing organizations try to leverage the hospital information system for a process it's not designed for at all. And then you're trying to be, again, not reactive and piecemealing, essentially tech, to make it work in the best way possible. At the end of the day, everybody's trying their best, and I feel what we often are seeing to ameliorate that is really just sitting down and taking the time, maybe like an hour or two, sitting down, just reevaluating every single one of those facets, every single one of those payment channels, and trying to see how you can maybe combine, limit some, replace others, find a solution that centralizes a lot of these core functionalities, as well as potentially finding one specific vendor for it as well, right? Versus finding different vendors, different reporting systems, different functionalities, different support, right? The support's another issue that we're seeing often, right? If they have an issue with the patient, well, now who do they contact to gain support to fix that issue? If it's not their issue, it's the vendor's issue. That's a big problem as well. So,
well, and you know, when things are fragmented, there is a lot of hidden consequences around that. You know, there's delays, there's errors, there's costs, and a lot of it that actually goes unmeasured. You know, we were having a conversation earlier today about when you look at the cost of payments, most organizations or most people only focus on one single element, which is a transactional piece, but they're not really considering that, like you said, what is the cost of having, you know, 10 different workflows? And specifically when those workflows have you know, when was the last time they reviewed that?
yeah.
When was the last time that anybody gave it thought about how they connect with each other? And so, and here leads into the next step, and the next thought is, if no one owns the full payment flow, because that's what I'm hearing from you.
That is it.
Can it ever be optimized?
That is a very good point. There are so many different departments in these healthcare organizations where it might be the accounts receivable for this, it might be the patient for this, it might be the release of information for this process. Nobody has ever came in and trying to review all of each unique payment flow. So maybe not finding one specific person to manage all of that, but potentially trying to collaborate might be the simplest way, right? Something that you can do today is just schedule half an hour and just try and map out all the different workflows.
Well, I wish it was as easy as half an hour, because, you know, we've walked into some very, diverse healthcare providers with 20 different business units, and you know that actually does exist. And, you know, going back to who actually owns that payment flow. And I think it's important to start looking at payments, you know, from the time a patient decides to actually make a payment, because they get that bill and there's a decision process that takes place there, choosing the right payment channel that they want for that specific moment, and moving and tracking that all the way to when that money gets deposited into the bank account.
Yeah.
I think that in order to optimize the whole experience, there has to be a little bit of ownership, because the question is who owns this process.
Yeah.
And again, as we discussed earlier, you talked about all these different tools, and they've been added, you know, over the years. People have moved on. Nobody really understands exactly how these pieces actually work together. In order to get to that state of optimization, there has to be, going back to your initial, you know, your last point, it needs to be mapped out. It needs to go from, I need to map out everything from the time that somebody makes a payment, decides to make a payment, all the way through when that money gets into the bank account and reconciled back into the systems. And I think that that's like an exercise, you know, and we can talk about that a little bit later, how we help with that. So now let's connect this to something every organization really cares about, and that's revenue. Okay, so where does revenue actually get lost when these processes are not fully optimized?
Yeah, everybody in healthcare knows about the ambulance bills, especially in Ontario. $45. It's a pain. We're seeing debt ratios of 40% on this. So a lot of them are not being paid. It's a big issue. And that is predominantly because of how complicated it can be to pay, right? It's, if you have to present yourself in person to tap your credit card for $45, you have to deal with all the parking, right? You might need to pay for parking actually to go pay your $45 bill. You would have to find the time out of your day during work hours, because the billing, the cash office is only open during 9 to 5, 8 to 4, these work hours, to go present yourself. That, we're going to the extreme on this example, but that could be a very clear sign of friction that would reduce your collection rates.
Well, it's interesting because, I mean, I like to call it invisible leakage, because it's we don't really know, and most organizations don't really know what happens when someone gets that bill and where the friction points are. We were talking, and you and I have had many conversations about this piece, is organizations, they wake up, the billing team shows up on the Monday, and there's 200 calls on voicemail, and now who want to pay? And I mean, we know that a percentage of those calls, because they were not answered, because they were not addressed when the patient was ready to make a payment, they may end up in revenue, to your point, that adds up to that 40% of bad debt.
Yeah.
And that, we talk to that as being lost revenue because of inefficiencies in the process itself. And these are things that can be fixed. I mean, this is the interesting thing.
Yeah, like we said earlier, it's not a tech issue. It's really a
these are not. It's not a tech issue. These are all process issues, and that's why we're super optimistic about this, because we know that a lot of these hospitals have the tech. The tech exists. Yeah. The tech is there. The tech can be tweaked. This is not rocket science. It's all about the process. Is about the small inefficiencies, right, that compound over time.
Very well said.
And those small inefficiencies, and I will, without mentioning hospital, we've talked to a couple hospitals, and they said, one of them actually, interesting enough, said, our web payments, we're only accepting one card brand, right? And just because it was a vendor decision, and then what the data actually indicated is that card brand overall in all other payment channels only represented about 20% of all other payments. That meant that anybody going through that web channel and landed and seeing, oh, you only accept this card, but I don't have that card. And now it ended up that 71% of patients were hitting that and saying, I can't pay here.
Yep.
And that, of course, goes back to that revenue, I call it invisible leakage, because we do not know patients who, because of the friction in the process, decide, something, I'm not going to pay for the hospital bill. I got to go and pay my utility bill. I got to pay my cell phone bill before I actually do this, right? Where it's more, because you started talking to me about more convenient.
Yeah.
So now, going into the next one, so naturally, healthcare providers are turning to automation. And I'm talking about, portals, mobile. We know that there's a lot of modernization now happening specifically in Ontario and in Canada overall in terms of healthcare systems, IVR. I'm going to ask you a question. From your experience, where does automation really work well in healthcare?
Yeah, automation, reconciliation is where we're seeing a lot of automation working really well. Staff, it's a huge staff burden. We've seen some hospitals with teams of 40 people trying to reconcile, right? On the phones, trying to take payments, reconcile that in the back end. It's a big burden. So automation from a reconciliation perspective, making that as smooth as possible, right? A good example is online payments, right? Online payments can be taken 24/7, 365, whenever they want, right? But then if you don't have that automatically reconciling back into your hospital information system, you then create yourself another burden where all of a sudden you need staff to go in there and reconcile all of this. Kevin has paid his $1,200. Okay, good. It's received. Awesome. Good. Next. Jacqueline's receiving $800. Good. Next. That takes a lot of time, right? So automation in that reconciliation part can relieve that staff time and not necessarily remove that staff, but allow that staff to do whatever they're supposed to do on a day-to-day.
Well, when you're
responsibilities, right?
Exactly. When you're saying to me 40%, about that, in some places, I mean, that staff, that's where really they should be focusing their energy, not on, like you said, the elements like reconciliation, the removing error rates, because I can see, like, to your point, you're describing a process, and I was talking to actually a healthcare provider on this as well. They probably get about 1,000 payments over the phone a month, and they have to manually enter every single one of those payments into their billing platform.
Yeah, that's a day, right? A day, 2 days.
And that means when Dave is not there to answer that call, when Jonathan actually decides, I'm expecting to call on the weekend, and you're not there, I leave a voicemail. There's a lot, when it comes back to reconciling back to the account, that manual process, I mean, is really where a lot of that friction, internal friction actually, and errors can occur.
100%.
So,
You know where
you
another
know,
place automation helps a lot?
yes,
Risk.
yes,
Risk
yes,
reduction, right? To your point right
yes.
there, where Dave might not be there that day. He might call in sick, then you can't reconcile or you can't take payments. Automation helps with that, allowing your organization to be able to take payments across time, throughout time, regardless of if there's another pandemic, right? Or even another risk could be PCI compliance, right?
Well, you're jumping into, it's almost like you read my mind here because I was jumping right into the compliance risk and reality topic. So I'm gonna pick your brain now because there's that other layer that doesn't always get talked about, which is risk. Most organizations don't understand it. Most people don't really want to deal with it.
Like we said, right?
So
Payments are an afterthought. What is PCI DSS, right? What is personal card information data security standards? Like, what is that, right? It's often the afterthought. So the last thing they want is an extra form they need to fill out. Here's another 300 questions you need to fill out for your requirements. I mean, these healthcare organizations, the payment is just a payment, right? I want to accept Visa. I want to accept MasterCard. And that's it. There's a lot of requirements. There's a lot of responsibility, a lot of risk.
So a lot of that, part of this thought process is where does risk really typically enter the process?
Yeah.
And, again, you started talking about people before, and, when you really map this out, and you're not just looking at the granular level, you're looking at the whole ecosystem from the time somebody decides to make a payment until that payment actually hits the bank account and then gets reconciled back to the systems, right? These are the areas where risk begins to really enter the process. People handling payments over the phone, because we do know that a lot of healthcare providers are doing that. I'm not going to go into an expanded mode here about talking about PCI scope, but it does, expand the PCI scope
100%.
element.
You have your human touch,
right?
To personal card information, right?
And again, people make mistakes. It's funny because we're in this era of AI, and a lot of people are going to and jumping on the AI, but a lot of this data is data that will unlikely touch AI because of the sensitivity today. Maybe perhaps in a few years when agentic commerce actually takes over this. But in the current state right now, we're dealing with humans. And human touching credit card information, whether it be before, after, or reconciling, it's risk. Whether it be from a security risk, from a process risk, from, we know, it's interesting because we were talking to another client and said, well, what's your error rate when accounts do not get validated? And they said, oh yeah, we're running on between 3 and 4% error rates, right? That's risk to the process, right? So the interesting thing here is, and I'm going to leave this thought, is like the more places payments touch people and systems, the harder it becomes to control that risk.
Yeah, and to our points where we talked about earlier as well, from a patient experience as well, that's impactful. I myself would not give my personal card information over the phone. I wouldn't want to do that. So if the alternative is me showing up in person, I would be very, very frustrated with that experience, but I would go in person rather than giving my card information over the phone. So I think it helps a lot, right? Thinking about those risks. There's a lot of components about automation, about helping make it more fluid for a patient to pay. Allow that 24/7, have that automatic reconcile, and have ways in which you check if there are error rates, right? Duplicates, something like this. You have ways of automating these processes to reduce your risk level overall.
Well, you just said measure.
Yeah.
Okay, so here's the interesting thing. I mean, in today, most leaders, you talk about the CFO office, you talk about the CIO office, you talk about finance, you talk about operations, never mind clinical. Everybody measures something. Everybody's measuring something. There's a KPI, there's things to track, there is, and I'm going to go back to healthcare, there's patient vitals. And, there's no CFO today in healthcare that does not actually have a dashboard giving them the data that they need in order to run their organization. And whether it's automated or it's provided by their teams of finance managers, they are running on data. Now, let me ask you, and I'm going to ask you this. I know the like. I mean, I can share my experience. How frequently that you talk to a organization that has their payment, they have data about their payment systems.
Yeah, you don't know what you don't know, and that's often what we're seeing, right? Where the reality is they don't see it. They have a hard time looking at it. They don't have that data. A good reason why is because it's fragmented. Right? It's that piecemeal that you're always seeing, right? Vendor for this, vendor for that. Here's a portal to log in. I have to log into this portal to report and export from here. This one I can't export. I have to go and put it in myself. There's so many different parts of it, so it's so
and the question, it's interesting because that's, I know, and I don't want to say that in the payment there's no data. What I like to say is there's I'm going to call it granular data about the payment processing side, for instance, about, cards that get processed and outcomes from those cards. That is very well documented. However, we seldom hear how many people are calling you, how many people are entering the online, how many people are actually going on your, like you said, showing up card present, how many people are using any other payment channel that is available. How does that metrics come?
Yeah.
And then what are the error rates? Like, for instance, how much calls, like, for instance, give you an example, like the one of the hospital, you had 200 calls, you arrive on Monday, and this is not just a one, unique situation. We hear this frequent. And I said, well, what's that look like? How much revenue is stuck there, right? And what does that cost? It's not the cost of the transaction because it's cost you already to get there.
Yeah.
How much is it going to cost you to recover that revenue when you actually have to call all these patients back and say, hey, Jonathan, I know that you left us a voicemail. You want to pay your bill, right? Well, how many staff do you have to make 200 calls? Because there is a cost to that.
There's a cost. You're absolutely right.
And there is a cost to not collecting that revenue. And then let's just say that because of this particular, I'm going to call it process inefficiency, because again, it's not the tool, it's the process. That ends up in collections. Now, all of a sudden, that 60% cost there ratio, or whatever it may be, that's now cost that needs to be added to the inefficiency of the process. And the good news, and this is really why I'm so fascinated about this conversation and where the opportunities are, is that all this can be fixed. It's just that we need to think about the process versus look at the tools versus all the tools are there. We need to rethink the process.
Yeah.
So if there is one takeaway from this conversation, and I'm going to say this, it's this. Most organizations don't have really a payment problem. What they have is they have a payment design problem. So now I'm going to go give you maybe you can share with me a little bit about what you think about this, but what do you think leaders should start questioning within their own organizations today?
Take the time to sit down and map out that process. I think whenever you get new technology, or most organizations are always asking for a data flow diagram. Do you have a data flow diagram of your own payment channels? What does every single method in which that payment can be taken, and where is that leading to? What is the vendor? Where is the reporting? Map out that process, and once you have their foundation, it is so much easier when you partner with a good vendor and a vendor that's there to help you to go and evaluate each one of those facets and see how they can potentially be combined, how they can be ameliorated, how you can potentially automate that process. Really take the time to map out your current status.
So what I'm going to leave the audience with here, and you and I have talked about this new process that we came up with, which is called How Money Moves. So I'm going to offer it to the audience to actually reach out to either you or myself to actually talk to us about this, because it is a complimentary service that we have to move from seeing how money moves from the time that a patient says, yes, I want to make a payment, until it hits a bank account.
Yeah.
And we understand that most organizations are busy, and this is not a complex process. And by the way, it's not a sales pitch. There's no decks. It's really getting down to the conversation. To your point before, how does the money move from the time that somebody says, yes, I want to make a payment, where those friction points are, where the revenue may be leaking, and how we can recover that back. And to your point before, how can automation be leveraged in order to improve this. So I will say that if you haven't mapped how money is actually moving through your organization, that's probably, to Jonathan's point, that is probably the best place to start. And again, thank you for joining us, Jonathan. This is Bernard Crespi. Till the next time.
All right. Have a great day.